When you check your body, you realize that there are some changes occurring, for example, on your breast. Like one breast appears maybe bigger than the other one, and it has not been so.
Yeah.
Right? Of course, the left and the right breast are not exactly the same size, but most of the time we can't realize. So when it is really significant that one is getting bigger than the other one, then you should notice something. There's a swelling. There's like something that is protruding. There's like a swelling. We call it, there's like a lump developing. Right? Yeah. So you see there's like a bump. When you check your breast, find there's like a bump somewhere, then you should suspect that something is really is taking place here. Sometimes the breast can produce some milk or some discharge or some blood.
Really?
Yeah. So if you know you are not breastfeeding and you're producing milk, then things are not right here.
You should definitely go get checked.
Yeah, you should definitely come to a healthcare provider and let us just have a look at it. You see? Yeah. Producing some milk. You're not, even for men, if you see some discharge coming out from your breast, some milk coming from your breast, and you know you are not breastfeeding as a man, obviously, or some blood is coming, then you need to come to the doctor, right? If you see your breast, when you look at your breast in front of a mirror, I'll talk about how you examine that breast. Yes. When you stand in front of a mirror and you see that there's like a dimple, not like a dimple, sometimes unakuwa na dimple, sometimes kwa uso wanasema huyu ako na dimple poa. Yeah, these are a beautiful dimple. When you see a dimple on your breast, then you should get concerned, because we don't want to see dimples on your breast. Just come, let us see what is happening on this. That nipple has been there. The nipple usually protruding outside for the baby to suckle and breastfeed. And then you just see it starts to retract inside. Goes inside. Yes. So when you see it going inside, then just come to us so that we see there's something pulling it.
And this is also for men as well.
And even for men. These are the signs. Okay. These are the signs. Yeah. Remember, it's the breast, right? Yes. So there's some fluid being produced. The breast is developing some lump. When you touch it, unasikia kuna kakitu ngumu hapa. There's something hard here. It has not been there, but it is now here. Okay. Right? Yeah. Even changes in color. There's an area there that is changing in color, right? We call it pigmentation. The color changes, it becomes, and you start wondering what is happening in this patch, this region. Yeah. It could be just a sign of something, right? So these are part of the things that I want us to know when you, and I'll go through I'll take you through how you do the breast examinations so that you can notice some of these things.
Let's actually get right into that, because sometimes as you're looking in the mirror, you might, now that you've mentioned it, kuna mtu anaangalia sema, na by the way, you know, because sometimes it's until you say it is when now I'm seeing it. But saa zingine it's just all up in our head. Probably it's okay, but maybe you're noticing, or probably you've been having those signs. But let's talk about how to examine even as you are at home. Before I can even contact you, Dr. Fred. Nikuje nikikimbia hapo kitu yako, I'm like, hey, angalia. You know, how do I do that at home?
Yeah. So before we examine that breast, there are some variations. During your menstrual cycle, when you're about just to undergo the breast also undergoes this menstrual, because they are controlled by hormones. So these changes usually occur, and your breast could feel a bit lumpy during that period.
Extremely. It's tough. Hata ukivaa nguo you feel
correct. So when it gets like this is not the right time to start doing this examination, because you'll start wondering, because it will feel lumpy and you say, these are the ones that Dr. Fred was telling me, right? So, and it is there, it comes cyclically every month. You feel it's a bit firm, and then also in young people, especially in adolescence, and in their even in your early 20s, right? When you just in puberty, there are those changes coming, because the breast is now getting very sensitive to these hormones, and then there are those changes that usually come. Sometimes it can even come with pain. These ones will just come to the doctor. The doctor will have a look at it, and most of the time they are physiological changes.
Especially for the late bloomers. Unapata as you're 18, 19 is when now your breasts are starting to protrude, and is when you're realizing, na feel chungu, you know, but it's not actually to say that it is breast cancer. Because these are changes in your body.
And you'll find that they are there every month. It comes, it disappears, then it comes with that cycle, right? Yeah. So the right time to do that is not during the towards your menstrual period or during the ovulation period. Is not really the right. So you can give maybe another 2 weeks. When now the breast is back again, back to its normal, and then you stand in front of your mirror. You just take out your bra, your shirt, your bra, and then you stand in front of your mirror.
Yeah.
And you are not in a hurry that somebody is going to come in that room, so there is adequate privacy, obviously, right?
Yeah.
So you stand, and your hands. I want you to imagine this when you're at home there. So you stand in front of your mirror with your hands on your sides.
Okay.
Nakumbuka they used to stand in school at attention.
Scouts.
Scouts, yeah. They used to stand with the
attention.
Yeah. Just stand with your hands in the right position, and then you look with your head straight in front. Just look at the mirror and look at yourself and admire how God made you. And while you are looking at that, look at the breasts, the way they are at that position.
Okay.
Are they in the same line?
Okay.
Yeah, right? Are they in the same line across? When you just draw an imaginary line chinia under the breast, and just have a look at it, are they in the same line? So that, is there one that is too high abnormally?
Okay.
Right?
Yeah.
Because there could be something holding it back, right? And then when you look at it, look at now the color. Is the color the normal ones that you know, the normal distribution of color?
Yes.
Right? The one that you've always known. Or is there a new reddening taking place? Right?
Yeah.
Is there a new thing? Are there new dots appearing? Is there something that is a bit protruding, is in the left breast but is not on the right breast? Because they are left and right. They're usually mirror images. They are like, they look like each other.
Yes.
Right?
Yeah.
So compare the left one and the right one.
Okay.
Same size, same level. Are they the same color, or there's one that has a new color? And then is there a new what? Is there a new? Are you seeing like a lamp? There's something that we call poudre, like the peeling of the orange. You see how the orange looks like icona dots? Yeah. Are you seeing something that is similar to that has not been there?
That is now occurring.
Yeah, it's occurring around that area. See that? Yeah. And then look at the any part of the breast and even the nipple. Is there either the left one or the right one? Is there one that is being pulled inside? Is one that looks like it's going towards inside? Is the nipple, are they all outside the way they used to be? I see that?
Yeah.
Of course, there are people who are born with theirs, the nipples inside. And those are anatomical changes. Those are developmental problems that must have been discovered early.
But it has always been like that for them.
For them it has always been. It's not a new thing.
Yes.
But this one, we are talking about a new thing. The nipples have always been out, but now this time it is going inside. There's like a dimple forming. The dimple that we are talking about, dimple forming either on that area of the breast or any part of that breast tissue. You see that?
Yeah.
And look at it. Ikona mbele, ikona place on the upper surface. Look at the side surface, right? And you'll also look at the lower part. So you've checked. You have said you have inspected. You just check.
Yes.
And then with your hands now at the side, the way you say that, then you remember they used to say raise your hands up from the side.
Yes.
Just you raise it slowly going up. I want you to imagine you raising your hands both together in the same fashion, so that moja isiende mbele ya ingine.
Okay.
And while looking at the mirror, and just lift it slowly from the side as if you are making a circular form, when like an arc, until you raise the vikono zipatane pale juu. Right?
Yeah.
So while you are raising it, look and see if one is remaining behind. Okay. Are they moving together? When you're moving, try and put them together. Just let them move out from the sides when they are going up. And just check, is one that is remaining while you, because as you lift your hands up from the sides, going upwards, they're also moving. They're also moving up. So just check them slowly. Just go slowly and see if there's one remaining behind. When you find that one is remaining behind, then it's likely that something is pulling it up. You may record that to help to explain to the doctor, because we are living
it's a very digital
space. So, you have those things. So this one now you're not going to post, but take it.
This is to your doctor.
This is for your doctor to help you explain. To help you explain these things that are occurring. And then when you've already done the raising, and you've finished with that, now we are going to the part where we are going now to start palpating. To palpate means with touching in a fashion, in a way, in a systematic manner.
Okay.
So you're going to start from somewhere, and then you end up. It doesn't have to be ufuatilie exactly what I'm saying, but I'm going to give you a simple way. You imagine your breast. It's one breast at a time. So one breast in itself is assume that the breast itself is a clock. It's a clock.
Okay.
Right?
Yeah.
So there's the upper part is 12 o'clock.
Okay.
Then the very lower part is 6. 6 o'clock. Then on the extreme end we have 3.
Yeah.
And the other one we have 9. Right?
Yeah.
So you decide where do you want to start. You can start from 12 o'clock. So you put your hand at 12 o'clock.
Okay.
Right?
Yeah.
And just in a circular fashion, you touch it in a circular manner. You press on it as you feel for, is there any new lamp, any new thing, new pain, right?
Yeah.
Pain might not be a sign of cancer.
And again, you emphasized and said, let's not try this just before your menses. For ladies. Because you might feel pain.
And then you start running around and start having palpitations. Yes, because during around that period of menses, the breast tissue usually becomes a bit tough, because of the menstrual changes. So he said we give it a bit 2 weeks down the line.
So as you go circular motion. So
you fill up with the 12 o'clock and just go small spaces as you go towards the right when you're going towards 3 o'clock. And circular, touching circular. Circular and just feeling 3 o'clock. Then from 3 o'clock we just go circular, going towards downwards. We are now going towards 6 o'clock. Now you're at 6 o'clock, you're still touching it and feeling and you press with the tips of your fingers a bit, not really at the top, but at least the surface of your fingers. And then you come towards now the 9. You go towards the 9. Let it be a circle so that you don't skip while feeling for something. And then after from 9, now we are moving towards 12. So you are there at 9, 10, 11, you are back to 12. And then finally also at the center. At the center. At the center you also press at the center where we have the nipple. So your hands just you separate your fingers so that your finger, you don't touch the nipple itself, but you just press while the nipple appears just between the fingers, between the fingers, and then you just press. So when you press there and feel for any lumps, generally globally, right? Any new lumps, right? And then now the nipple itself, you can try and squeeze it. Just try and squeeze and see if there's any discharge, any milk, any color of any fluid that has not been there. It's coming out. Right? Do the same to the other breast.
So this was at 1.
One at a time. So you started with the left one. Sarah? Now copy paste. Do that one what you did on the left
to the right.
Do it on the right.